pages. Last time we had 3.
I'm not buying it.
Maybe something else
So I thought I would sit over here.
Oh, there's a
and then
page
you
on
all
the back that
still
says county
see
administrator.
I'd be in favor of that.
Administrator.
International, like you and
I don't know, they got me,
Straight line.
Yeah.
got me confused.
They kept buying them little Ford vans.
I'm all
Every time that one
confused right now.
passes me, that Stevens Point.
That makes me mad.
But, you know, one thing they didn't do with this one here, it says for discussion purposes, but they didn't put that on this one.
But I said,
If it gets as long as it got last month, I think we're gonna table a few things and get the heck out of here.
But you know what?
past 8 years old, and the engine's getting bad.
Just turn up a little bit
Go to
further.
the wrecking yard and
I don't know.
buy a
I
good
guess so.
used one,
I guess
put
so.
on it, and leave it for spare.
Yeah, I mean, I'd have to scan.
Don't get much on trade on that.
Kevin owns another house. Kevin will be so, Ollie would be so mad because
Who puts the stickers on you?
And then that way they're never short
he
of
has
anything.
stickers.
You didn't have no stickers? Good point.
She wake up and got free pizza.
I might have a
Oh,
snack
okay.
bar, but they were both still here when I
Well,
started.
let's see, we get out of here at 9 o'clock, it'll be 7 o'clock in California, we still won't know who the president is.
I don't think we're gonna know till sometime tomorrow anyway.
Yeah. And I don't think it's gonna be an easy transition, because one's gonna fight the other one, they'll be fighting till.
If anyone's here to speak on the budget, there's purple sheets at the front of the room that you can use to sign up to speak on the budget at the public hearing part, and then the white pages at the front are just the regular public comments. So just so you know, I don't think anybody from the public's out there, but.
I beg your pardon, Carol.
Oh, Karen. Well, she's part of the county board, really. I mean, honorary member.
Like honorary
46 and 447.
the whole year. I go to Florida for 3 years.
6:59, so whenever you're ready.
Close to it.
Cause she ain't got a microphone.
All right, let's call the meeting to order. Mel will do roll call.
Mrs. Krentz.
Here.
Mr. Heisey.
Here.
Mr. Tim.
Here.
Mr. Cap.
Here.
Mr. Eckstein.
Here.
Mr. Weddy.
Here.
Mrs. Collada.
Here.
Mr. King.
Here.
Mr. Wadel.
Here.
Mr. Rothermel.
Here.
Kirschner.
Here.
All present.
Okay, now we'll stand for silent prayer and pledge of allegiance, and please remember our veterans because it's almost Veterans Day. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Now I'll ask for an approval of the agenda.
I so move.
Motion by Weddy.
Second.
Second by Cap. Any questions? Yes, Larry.
You all know the question about which came first, the chicken or the egg. And we've all heard the expression, putting the cart before the horse. But in our agenda, I noticed that we appropriate funds for a department before we create the department or approve the department. And I think it should be the other way around.
I'm assuming you're talking about the $80,000 that was put in the budget. Is that what you're talking about for the
Yes.
financial position? All right.
Well, I can comment a little bit on that. It actually, it's money that was taken from surplus, so if you decide not to use it, it just doesn't get taken from surplus. So, you can look at it either way, I guess.
Any other questions? All right, we have a motion and a second to approve the agenda. All in favor?
Aye.
Opposed, same sign.
No.
Thank you. All right, we need an approval of the minutes of the October 18th, 2016 monthly meeting. questions or comments concerning the minutes? All in favor?
Aye.
Opposed, same sign. Next, we have unfinished business and a discussion and possible motion action item. Oh, I'm sorry, public comment. Oh, I'm way ahead.
Nobody's
I
signed up.
guess I'm in a hurry to get home. Next, we will have the 2017 budget public hearing. Guess there's no one from the public, so we will move right along. To public comments. And there's no one here, so we'll move along. Unfinished business. Discussion and possible action, motion action item. Administrative coordinator and county administrator job descriptions. You all have that. You got a copy of it in with your packet. And then Deb, after our meeting yesterday, has done some changes, and I think, do you want to explain the changes, Deb?
Sure. Basically, after we met with the department heads, one of the items on the original administrator job description was to provide billing for mediation service in family court. The courts has agreed to take that over, so that particular piece was pulled out, and the other change really was just that the numbering of the items was changed. So, very minor things.
The other change that we saw at executive yesterday is on number 2, and that writes in explains a little bit more about how we will deal with an administrator concerning the department heads. I know you're all worried that this would take the place of committee having the responsibilities. So now the administrator will still have the responsibility, but Deb has written it in there so that they meet with the committee before any action is taken. So, is there anything else? Did I leave anything out? I know I stumbled a little bit there.
No, you did good. So basically what I did is I reached out to my counterparts and got some samples. You had told me to incorporate the administrative coordinator job duties that were both in the job description and in the bylaws. So those are incorporated into this. And so I just looked at what some of my counterparts, how their things were worded, and I drew from that. So I listened to what some of your concerns were that were expressed last month and changed or added some language to the number 2 so that the committees still feel that they have a seat at the table.
Mel steals it from me on this. All right. Is there any, do we have a motion, first of all?
I would make a motion that we would pursue the administrator position.
Okay. And that's a motion by Weddy, second by Kirschner. Now we'll open it up to discussion if anyone wants to weigh in on this. Larry?
Would the administrator appoint members of the board to the various committees?
I think the county board chair still does that.
The citizen people, right, Ruth? I think it's the citizen reps.
I think that the statute says that they would do the citizens and then have input on the rest of them, so it wouldn't really change the process from what we're doing today. It would still all be with confirmation of the county board.
Thank you.
When I was reading about administrator responsibilities and some other, like the information we get from the county association and different places, it seemed to indicate that the administrator would make those appointments, all appointments.
They do, but it's with confirmation of the county board, so the county board can say no. So it really is not going to change the process a whole lot, although we would not necessarily have to have an organizational meeting where we have a break in between. The administrator could perhaps come in with some ideas ahead of time.
Yes.
From the way the law is worded, it's nothing to do with the committees. The administrator appoints boards and commissions, not committees.
Right.
But that's what this says, but that's not what the statutes say.
Yeah, that's what's right here.
That's from the statutes?
That's from the statutes.
Bottom of page
59.18.
So Ruth, just as a suggestion to alleviate any concerns, some wording could be added into the job description that would more clearly define that role?
It could be. I think that it's a matter of how the statute defines boards and commissions, and you define that. I mean, those words are synonymous in some situations, but you could certainly put in some language in the job description on how you wanted that handled.
All right. Larry, do you have any? Are you saying you don't want the administrator to appoint the committees? You want to keep it as it is, as it's done now?
No, I just want to bring it to your attention that that is what the change could be.
Would we still have to, the board still elects, like, Public Works and the ones that we now elect? So you're talking about, like, the
ones that you
public
appoint.
safety, the ones that I appoint. So we could maybe add that the administrator, along with the county board chair.
Sure. I think it would just be another sentence in the number 2. It already references the appointment of citizen members, so you would just add to that, I think, right?
Yes.
So can we pass that with that addition to it? Or do we have to come back? We
Well,
can.
you have to have a resolution at some point.
Right. So you could certainly agree that you're going to do an administrator or administrative coordinator tonight is what's on the thing. And then we would have a resolution that would, because Deb's position was created by resolution, so we would have to amend that resolution indicating that the county was now going with an administrator. And you could make an amendment to the job description at that time.
All right.
My motion was to pursue the position of administrator.
Okay. All right. So we have a motion and a second. Is there any further discussion? Hearing none. All in favor?
Aye.
Aye.
Opposed? Then we'll continue to work on the details. All right, new business. We have reports and presentations, and first is Director Kim Stebbins of Child Support Office Annual Report.
Evening. Are these your kids, Kim?
No. That's on. First, this is just an overview of kind of an organizational chart. The Office of Child Support Enforcement, they are the federal administrators of the child support program. Below that would be the Bureau of Child Support, which they manage the child support program here in Wisconsin. Then they come down to the county level. So you'll see that we have 3 specialists here in our county, a director, and then we use our corporation counsel as our attorney. The services we provide, just reviewing that we do paternity establishment, and that is done by referral from economic support, or somebody can apply for our services. Establishment of court orders and health insurance orders. That also is done by referral or by application. We do not get involved in custody and placement issues, but sometimes the court does rule on those things when we're in court. collection and enforcement of child support, administrative and judicial. While we do utilize civil contempt actions, we had referred 25 cases from January of 2015 through October of this year to the district attorney for criminal charges. Pointing out one case this year that we had referred, they had paid off their arrears of over $25,000. Collection of arrears and also locate. Agency performance. We have a caseload of about 1,100. It fluctuates 1,100 to 1,200 cases. That was as of our the end of our federal fiscal year. That goes from October through September of the following year. So the federal fiscal year 2016 performance rates. There's federal performance measures. The goal is to reach 80% on each of those 4 categories. I've listed the actual one for our office, and I also listed the state average, so we are above the state average in all categories. We did fall a little bit short on the current support collection, but did reach the goal on the other 3. A few facts. Have $3.1 million in current support that was owed here in Waushara County this last fiscal year. We were successful at collecting $2.5 million. That comes out to the 78.89% of the collection rate. Wisconsin's child support program ranks 3rd in the nation for collecting current child support. 74 county and tribal child support agencies provide case management services, and there's about 360,000 child support cases in Wisconsin. This year and the last year in 2015, Governor Walker did proclaim August as Child Support Awareness Month. Wisconsin's child support program is one of the most efficient programs in the nation. County child support agencies in Wisconsin collected $639 million in child support in 2015. So for every $1 that's invested in our program, we collect an average of $6.76 in support, and that is $1.15 more than the national average. So we are a very efficient program. In January, the U.S. Census Bureau released the custodial mothers and fathers and their child support report for 2013. $32.9 billion in child support was due annually, according to that report from 2013. A few highlights from their report. 1 of every 6 custodial parents were fathers. Child support income accounted for over 2/3 of the mean annual personal income for custodial parents below poverty who received child support. About 3/4 of the custodial parents who were due child support in 2013 either received full or partial payments, and less than half received the full payments. About 68.5% of the $32.9 billion in child support due in 2013 was reported as received, averaging $3,950 a year. I think I calculated that out to $329 a month average per custodial parent due child support. The proportion of custodial mothers with income below poverty was higher than that of custodial fathers. So what's ahead in 2017 for us? We do have some things upcoming. The e-filing, that is going to start in February, so we're preparing for that and hoping that is going to be a smooth program for the courts. And WeKids, that has been a new program and that has been developing, hasn't been rolled out yet, and it looks like it may be in late 2017. Just changing from to more of a web-based program. So that is all I have. In case you have any questions, but
I have a question
Yeah.
for you, Kim. Has the publishing of the arrearages in child support in the local papers had any effect on what you're collecting? Do you think it has?
I'm not sure. I know that, we have gotten some calls regarding if you're the warrant listing is what you're referring to?
Correct.
Listing, yeah. I mean, it has, I think, has some public, I don't know how you want to call it, but I mean, people are realizing how much people actually owe who have these warrants out there. But I don't know if that's helped or not. It just kind of gives the names out there in case we can get them picked up and brought back into court for collections. It's just an effort to try, and we're thankful that the paper will publish that for us. So.
I would add that some of the local law enforcement agencies ask for those lists, and then they make an effort for people that they're aware of to go and find them. And I get emails almost every time that we post one with some kind of locate information on one of the people on the list saying this person is here, or at least a city, and we might not even know that.
Yeah. And we have a Facebook page, and we share the list on there, hoping that it would get more shares and such. So, yeah.
Good. Any other questions? Thank you, Kim. Great job. Next, we have Veteran Services Office Annual Report. Our Veteran Service Officer, Bill Rusno.
Good evening.
Good evening, Bill.
Should have in front of you an annual report. I did a quick report on the veterans charities. One thing I wanted to point out about these veterans charities, when I started researching the veterans charities, there were 253 different veterans charities listed. I only went with the ones that have actually reported to the Better Business Bureau and are currently viewed as accredited. Quite honestly, if you have a charity in mind and they're not on this list, that means that they have failed one part of their review with the Better Business Bureau, and you might want to look twice. My advice as a county veteran service officer is, let's say, pretty self-serving. If you're looking to give to a charity, we've got a Veterans Commission Fund right here in Waushara County, and 100% of that goes to veterans in need. Also, you'll see a federal GDX. That is the gross distribution of expenditures from the federal VA to residents in the state of Wisconsin. It is broken down by county. Important to understand when you're looking at these numbers that we're talking in millions. So add 3 zeros after any of these numbers. It's important to understand when you're looking at these numbers that these are raw numbers, unadjusted. It's pretty much a given. Talking with Professor Deller from UW Agriculture and Applied Economics, that these dollars actually turn over 4 to 7 times in a local community. I'm not going to bore you by reading you the report. I want to point out one error that I have up here on the slides. Moving to last year, that 8,209 is actually 8,267 records that we managed in 2015. Even as we lose veterans and their dependents, that number is going to continue to go up because we maintain those records for life. In 2015, I met directly with 716 veterans and their dependents. That resulted in over 10,000 traceable actions. We continue, as we have in the years past, to see a less utilization of state veterans benefits. In large part, that's due to a lessening pool of benefits, but also a growing pool in alternatives. A study I read from Indiana that was looking at utilization of state benefits, they found that the more robust the state benefits, the less dependence there was on federal benefits. So actually seeing a decline in the utilization of state benefits is translating into a larger utilization and bigger federal dollars coming into the state of Wisconsin. I have not seen adjusted numbers for economic impact for calendar year 2015 yet. but just for instance, the efforts of County Veteran Services in the state of Wisconsin in 2014 resulted in $2.4 billion coming into the state of Wisconsin in federal dollars, and that's unadjusted. Some huge changes to the County Veteran Service Officers Grant in 2015. As a rider on the budget in 2015, they changed the what was a block grant structure to a reimbursement, and then applied some fairly onerous evidentiary requirements that really put state support to these local offices in question. Bottom line up front, that problem is being addressed. We did manage to turn it around earlier this year, and what was projecting, when we were projecting basically a $10,000 shortfall from state expenditures, we actually ended up turning into a $10,000 gain. That actually resulted both years in coming in significantly under budget for the office. But a lot of that is blamed on me being very, let's say, frugal with the projection if we were going to gain that income from the state or not. Next slide. 2015, since coming on board as a County Veteran Service Officer, I was, well, recruited to be part of the leadership team for the state for CVSOs. That resulted in my being the president of the State Association in 2015. Usually that's not too tough a job, but 2015, it really was. It was a very interesting year in veterans politics. On the training side, I've transitioned from, in 2015, from just gaining and maintaining basic accreditation to reaching a higher level of training and understanding of veterans law through the National Association of County Veteran Service Officers. That's referred to as Certified Veterans Advocate. That's a course of study that's taught by Board of Veterans Appeals judges, veterans attorneys nationwide. The focus is a deeper look at precedential law and how to affect better outcomes for claimants, specifically at the appellate level. I already mentioned the changes in policy for the grant. We also saw some changes in privacy policy from the State Department, Wisconsin Department of Veterans Affairs, that affected our access to and our communication with the representative agency at the VA regional office. Restricted a lot of information and feedback going to and from that office. And more on that in a little bit. We did work with Wisconsin Counties Association, various veteran community stakeholders, such as the Big Six, the American Legion, Veterans of Foreign Wars, etc., to oppose the detrimental changes in policy and to begin to try to rebuild a relationship with the Department of Veterans Affairs, the State Department of Veterans Affairs. In 2015, that relationship was really in question. I can very proudly say that we've managed to turn that boat around. It looks like we got it pointing in the right direction. Next slide. Again, based on the initial projection that we would not receive the CVSO grant in 2016, now that it looks like we are, we're actually projected to come in that amount under budget. Actually, I'm going to correct that. I was serving as the president. I'm now the immediate past president. I maintain a position on the state's executive board for another year. Completed my second year of CVA training, and I have been approached by the National Association of County Veteran Service Officers to be a part of their Washington, D.C. legislative team. I told them no. I just need to concentrate on the office for a bit. We are working with WDVA currently. I am part of that ongoing effort to reform some of the policies that negatively affected our offices. And we are working on some pretty exciting collaborative initiatives with that State Department now. On a couple of issues, we've just agreed to disagree as a CVSO association. We're always going to differ just because of our differing roles. Mine as an advocate, theirs as a regulatory agency, to just not talk about a few things, but to collaborate on things that we can. One of those initiatives is starting to roll out right now. It's the Zero Veteran Suicide Initiative. You may have heard the term 22 a day. That's the number of veterans nationwide committing suicide. It's far outpacing the suicide rate of the civilian population. Recently, that number's been adjusted up to 27 a day, and that's actually a very conservative estimate because there is no united reporting to tie together suicides with a veteran demographic. The Zero Veteran Suicide Initiative, we're sitting down with pretty much every single veterans community stakeholder in the state, and we're putting together a four-pronged approach. The first is getting information for crisis management into the hands of the people surrounding veterans. The second is, I don't know if you're familiar with QPR training. It's a system called Question, Persuade, Refer, which trains people and gives them the knowledge that they really have to confront suicide. They can't tiptoe around it. The remaining two parts of that initiative are going to be a little tougher because they're running up against federal law. You may be familiar with the IMA exclusion, which basically discludes the expenditure of state Medicaid dollars or federal dollars on institutional mental health or substance abuse care for those individuals between the ages of 22 and 64. Guess where the bulk of our veteran suicides are? They're right there. We're seeking an exclusion from that IMA exclusion for the state of Wisconsin and veterans. And we're looking at initiatives to bring more people into the healthcare, into the mental health and substance abuse arena to address the growing need. All right. Still noticing a reduction in the growth of our paper footprint in the office. Over the last couple of years, we've really increased our reliance on the digital environment, and we're growing less quickly. The first few years I was here, I put in, I think it was 7 file cabinets worth of files. We've actually, because of the use of the digital environment, slowed that down to 2 file drawers of paper. We're producing most of the records electronically now. Really seeing a big upswing in the Vietnam veterans approaching the office. Anecdotally, what it looks like to me is we have a lot of the Vietnam veterans retiring and now moving to their summer homes here in Waushara County. So we're getting a lot of folks from Milwaukee and Chicago permanently relocating to this area. Don't know what changed with the OAF or OIF veterans, but they're finally starting to come into the office. I had 5 brand new veterans to the office just today, and 4 of those were our OEF, OIF vets. They're usually not dependent on seeking assistance from folks like me. They usually want to do stuff electronically themselves or through social media. But somewhere the worm has turned, and now they're actually starting to approach the office. I'm very pleased with that because they do need the assistance. VA electronic access to VA records has really changed how we operate. As the VA bolsters their electronic environment, it gives me access to the entire veterans file. Their medical records, their service records, their official military personnel file, their in-service treatment records. All of the evidence that's being considered in a claims action, once it's introduced in this electronic environment, I can now review it. And it's really changing how we can track and influence claims. and specifically to the appellate level. If I'm looking at the exact same evidence that the VA considered in a denial, it gives me better ammunition to argue and to prepare a legal argument to defeat them. The National Association of County Veteran Service Officers has introduced some legislation at the federal level that has the potential to really change how the whole law process works in a veteran's claim. The big things are it places timeliness standards on the VA, which has never been realized in the past. To put things in perspective, when a veteran comes in to me with an initial claim, I'm usually looking at anywhere from 8 to 12 months for an initial decision. And if we have to pursue that to an appellate level, the first chunk of the appellate level at the local VA regional office of jurisdiction is 2 years before I see a new decision. And if it has to go to DC, we're looking at another 3 to 5. This has the potential to really change that by putting 120-day blocks on the VA to actually make decisions and get information back to a veteran. So more on that as that develops. All right, we have veterans who are living through stuff they never lived through in the past. They're suffering exposures to things that, Vietnam, it was Agent Orange. OEF, the Desert Storm, it was oil fires and some of the side effects of the weapons of mass destruction that weren't there. Now let's throw in there oral prophylaxis, untested vaccinations, the very dust that they were exposed to in Iraq and Afghanistan was toxic. The open burn pits that they've now found. I can't even get it. I'm not going to get on that soapbox. I'm sorry. It's just the exposures that our current crop of veterans have suffered is mind-boggling. And the health effects that they're realizing and the only partially understood longevity of those effects is lending to a really increased complexity in claims, a level of medical understanding that we didn't have to worry about with previous eras of veterans. That in itself translates to increasing complexity in the VA's law surrounding those claims actions, and the level of understanding at our level simply to address the need has gone through the roof. We're seeing a change that just happened 1 October where the VA, they used to do their own in-house examinations to develop the level of disability. They're now contracting that out. In the states that have this working, it's working fairly well. I can't say that about Wisconsin yet. Just in the past 3 comp and pen exams where they used to drive out to the VA Medical Center in Toma, they're getting calls to go down to Rockford, Illinois, to test their hearing. Working with the VA on fixing that right now. Veterans Choice continues to be a huge burden on veterans. We have veterans who are being handed medical bills for things that happened. The VA was supposed to cover that bill 6, 8, 10, 12 months ago. And now the medical provider is saying, nope, we're not getting paid. Mr. Veteran, you're now responsible for this bill. That's really increased some business to our office. Stab v. McDonald, Court of Appeals for Veterans Claims in 2015 basically told the VA that they were looking at emergency room treatment and reimbursement for or payment for that. They were looking at it wrong. They had ignored entirely the provisions of the mill bill, and they got called to the carpet on it. The VA has now appealed Stab v. McDonald basically saying, well, now we're not going to pay any emergency room bills until this is settled, transferring that liability onto the veteran. Again, that's increasing a little bit of traffic into the office as we address that. And however dependent we are now on the electronic environment to review and track claims, they still have not given us at the local level an electronic means to submit one, other than some very simple actions like adding a dependent or a very, very simple claim. So the VA is really touting their dependency on their dependence on an electronic claims process, but that's internal to the VA. They really didn't have us in the production of the claim in mind when they put that together. We are moving, however, slowly towards a fully paperless environment. I don't know how many of you have ever been involved in a paperless environment. Really what they mean by that is they lower the production of the paper to the lowest common denominator. That's me. So we still depend a lot on paper. We just reproduce a lot less of it. I talked about the increasing complexity of claims. That just in research alone has really raised the bar on the level of research I have to do on each claims action. And even though we are moving into this digital world, we are looking at the potential down the line for more eyes on as we try to address these claims. And next. First, I'm going to ask you folks a question. Is what I'm reporting what you want to hear? If you have any suggestions, if you want to see more, if you want to see less, let me know. Yeah, I wish it were all puppy dogs and roses, but unfortunately, when we're dealing with the federal government and the complexity that they tend to put up, between their benefits and the individual, it's not always fun. Barring any questions.
Any questions for Bill?
I think what you're giving us is fine. I'm happy with it anyway. I don't think you're going overboard, and yet it's stuff that at least I didn't know.
With all the groups that you're working with, Bill, have you, I know we've talked about this before, are you currently working with MOA, and if not, why not?
Sort of. Yes, we have reached out to MOA. And the reason that we haven't worked directly with them in the past is because that's not how they're structured. When we have, for those who are not familiar, MOA is the Military Officers Association of America. They're one of the most powerful and respected federal lobby groups when it comes to veterans law, veterans benefits. Most of the big six, the ones that have a seat at the table in Washington, D.C., that's the American Legion, the Veterans of Foreign Wars, Disabled American Veterans, Paralyzed Veterans of America, Vietnam Veterans of America, and Military of the Purple Heart. They're structured so that they have a membership base out here in the community. Pretty much every town, we have, I think right now, 13 different veteran service organizations that are a membership group here in Waushara County. Or close to the borders. The Military Officers Association of America is not organized that way. In the state of Wisconsin, they have, I believe it is 5 districts. Each one of them is a separate club, and they don't answer to a united body or have a united chain of command or input mechanism. I am working with gaining the CVSO Association of Wisconsin a presence at their Northeast organization, and that'll be kicking off this year. And from that, we're going to basically leapfrog into the other organizations statewide. 2 years ago, we started our formal interaction with the American Legion. Last year, we saw the inclusion of the VFW and the Disabled American Veterans in that group. The plan is, a state association, is to gain a permanent relationship with each of the state agencies, at least the Big Six and now MOA.
Great. Okay. Any questions? Thank you, Bill. All right, now we're going to move on to discussion and possible motion action items. And the first is 2017 personnel policy changes that came in your packet as well.
All right. So generally, about once a year, I will go through and make sure that things are up to date and the policy is mirroring what activities are happening. So the changes were underlined and italicized just for the ease of discovering where the changes are. Some of it is just, some basic cleanup work. Added our mission statement to the cover, changed the table of contents around a little bit. It was getting too long for one page, so made it into 2 columns. There really aren't a lot of substantive changes here. We've added the HIPAA policy and some of the system access policies, things like that. Ruth's working with a consultant right now to make sure that all our HIPAA compliance things are in place. The ETO on page 15. So we had a sentence in there that on their anniversary date they could carry over 48 hours. In the ADP system, I'm not able to put a cap of 72 hours plus put a max carryover of 48. So the reality is that wasn't working, and so basically they have a cap of 72 hours, and that was just to work within our system. Health insurance on page 16. Basically, we have had the county's been paying 85% of the premium, but last year, or for 2016, we put into place a second type of WPS offer that it ended up being that the employee was paying 23.1%. So we basically changed that language a little bit to that the county's going to determine the premium share to reflect some of those practical changes. And then a lot of the system access policies followed, and those are fairly long, take a lot of pages, but that's a lot of what it was the system access and the HIPAA complaint and sanction policy. So those are the major changes. We've added some technology, hardware, and software disposal. Basically, that's what IT governs IT and how they get rid of things. And then the personal mobile device and personal computer use, remote access, that just kind of reflect our changing times. So these would, if approved, they would go into effect January 1st of 2017. And so they get incorporated into the main document. This document actually is provided electronically for employees, so they don't have to look at all 67, 70 pages. They can just look at the highlights and see what the changes are. But the entire policy they have access to that on our intranet site, which is an internal system for employees.
Make a motion, we approve.
Thank you, Deb. Motion by King, second by Eckstein. Are there any questions or comments? Hearing none, all in favor?
Aye.
Opposed, same sign. Thank you. Next, we have consideration and possible action on the following resolutions.
Resolution number 26-11-16, resolution approving the Waushara County 2017 budget appropriation.
Motion to approve.
Motion by Weddy. Second by Kirschner. Any questions or comments? All in favor?
Aye.
Oh, I'm sorry, roll call. Sorry, Ruth.
That's okay.
Usually she's down here. Making faces at you.
I'll just give you a heads up, Donna. You need a roll call on all of these, okay?
Okay, Mr. Weddy.
Aye.
Mrs. Collada.
Aye.
Mr. King.
Aye.
Mr. Wadel,
Aye.
Mr. Rothermel,
Aye.
Mr. Kirschner,
Aye.
Mrs. Krantz,
Yes, aye.
Mr. Heisey,
Aye.
Mr. Tim,
No.
Mr. Cap,
Aye.
Mr. Eckstein.
Aye.
10 ayes, 1 nay. Okay, resolution number 27-11-16, resolution reallocating assigned fund balance for communications center remodel.
Motion to approve.
Okay, motion by Mr. Wadel, second by Mr. Rothermel. Any questions or comments? We will have a roll call vote.
Mrs. Collada,
Aye.
Mr. King,
Aye.
Mr. Wadel,
Aye.
Mr. Rothermel,
Aye.
Mr. Kirschner,
Aye.
Mrs. Krantz,
Aye.
Mr. Heisey,
Aye.
Mr. Tim,
Aye.
Mr. Cap,
Aye.
Mr. Eckstein,
Aye.
Mr. Weddy,
Aye.
11 ayes.
Thank you.
Okay, resolution number 28-11-16, resolution authorizing a finance department for Waushara County.
Motion by Cap, second by Kirschner. Any questions or comments? Hearing none, we'll have a roll call vote.
Okay, Mr. King,
Aye.
Mr. Wadel,
Aye.
Mr. Rothermel,
Aye.
Mr. Kirschner,
Aye.
Mrs. Krantz,
Aye.
Mr. Heisey,
Aye.
Mr. Tim,
No.
Mr. Cap,
Aye.
Mr. Eckstein,
Aye.
Mr. Weddy,
Aye.
Mrs. Collada.
Aye.
10 ayes, 1 nay. Okay, resolution number 29-11-16, resolution authorizing the addition of a full-time sworn officer deputy position.
To approve.
Motion by Weddy, second by King. Questions or comments?
And where is this money coming for this new officer?
Marion will be paying for the
All of it,
officer.
that's
Yes, for all of it. The town of Marion will pay for that. Yes. Before, when it was a part-time, they weren't paying the benefits, so now they'll be paying all of the expenses concerning this officer.
The village of Red Granite is not in Marion.
No, it's just town of Marion. And we'll need a roll call vote.
Mr. Wadel,
Aye.
Mr. Rothermel,
Aye.
Mr. Kirschner,
Aye.
Mrs. Krantz,
Aye.
Mr. Heisey,
Aye.
Mr. Tim,
Aye.
Mr. Cap,
Aye.
Mr. Eckstein,
Aye.
Mr. Weddy,
Aye.
Mrs. Collada,
Aye.
Mr. King.
Aye.
11 ayes.
All right, thank you. Next, we have an appointment, and that's for Veterans Commission, Patrick Fox, Watoma, term January 1st, 2017 through December 31st, 2020. Motion by Eckstein, second by Wato. I'm sorry, Bernadette. Any questions? All in favor?
Aye.
Opposed? Okay, any board suggestions for future agenda items? Yeah, we do. We do have, we have a tablet. Carol is using it now to see. We just need to know if you're interested in having a tablet. If you're not, that's fine. But Larry, you want to comment on how well you did with yours at East Central Planning?
I haven't used it much yet.
Okay. All right.
Got it a couple weeks ago.
Yeah. But it's, you know, it's entirely up to the board whether or not you want to have one. I think it's the way most boards are going. I've used mine from East Central, and it's, you know, you carry around a tablet instead of all the papers. Not only that, I can locate my minutes instead of having to go through the pile of papers. But we just need to know if you're interested, if you're not interested. But instructions would go with it. You know, we would have Barry come in and work with us. So can we have kind of a show of hands on who is interested in having a tablet? Oh, Bob, wait, I can't get over it.
Poop occurs.
What?
Come on, Russell, don't hold out.
Occurs.
You and I held out the last time, Russell.
Okay, all right, we will continue looking into this then. Thank you, I appreciate it.
I
Now,
have-
yes, Everett?
On this administrator, we're looking into it, we're going to do it, but should we choose up sides on exactly what the powers should be? This was discussed very early. When you bring it back as a resolution, or how are you gonna go about deciding what should be in there and what shouldn't? You were making suggestions to Debbie, you should do this, you should do that, but who's gonna sit down and bring this to fruition and decide?
I think Ruth.
Yeah, we'll leave it up to Ruth.
We will draft a resolution that will include a job description. It will go to executive next month and then come back to you guys. So, and any amendments can be made at the meeting next month.
I'm just trying to make it easier so we don't have to go through every, month after month after month.
Right. Well,
Hey, I wish this was in there. Oh, I
we've
wish this
got to
wasn't.
come to a decision soon because we got to start putting the feelers out and advertising this job. So at that point, we have to know just exactly what we're looking for, and in all fairness, they know what we're looking for. So the sooner we can do that,
And I suggest to the board that they go through this and what they don't care for, to possibly let you know or let the executive committee
That-
know what they would like to
that
see
would
and
be
what
fine.
they wouldn't like to see.
yeah,
So we might be able to do it in one time
Yeah.
instead of,
exactly. And, and then the executive board can look at those suggestions and, we can go accordingly. Good idea, Everett.
Probably goes kind of fast anyway, because in here I see where if you lose the one that you got, you get 15 days to have somebody from the board take over. And you have a new one in 15 days, so there
Well,
must be a lot of them out there.
Well, and right now there is some turnover in this area, and so some counties are considering having a standing resolution that would also, and maybe you want it to be part of your resolution, so this is also something to think about as to who would be the interim administrator if you lost it. There are counties that are doing that different ways, but they're having a standing resolution that says that the corporation counsel or the county clerk or somebody, they're designating who would be that interim administrator in case your administrator left for some reason. So I think that might be something that we want to look at including in our resolution so that we've already addressed that contingency.
Okay, very good.
And then I would just like to remind everybody that we are currently in negotiations with our two unions. So there is a possibility that there will be a second meeting in December if we get things settled. That is written in the bylaws that it would be the last Tuesday of the month. So you're looking at December 27th. So just keep that date open as a possibility. We're in the very early stages of negotiations, so I don't know that that will come to fruition, but I don't want it to come to us as a surprise.
All right, thank you, Ruth. Anything else? Everett.
to adjourn.
Okay, we have a motion by Eckstein, second by Tim to adjourn. All in favor?
Aye.
Opposed? Thank you.
Spend too much money.
Did I speak up better? Where's Ruth?